So basically, today we're gonna start a surgery topic, general surgery. It is basically the cancers of oral cavity. So let's start it. In introduction, we will study about the boundaries of the oral cavity. Number one, it is entirely bordered by the lips, basically, and then cheeks on each side, basically, and tonsils posteriorly. Superiorly, it is by palate, and inferiorly by the floor of the mouth. Okay, oral cancers are the most common cancers in the head and neck region, and the most two preventable factors are alcohol and tobacco. Basically, they are saying. uh And then, if you can see it, the patients who has oral and pharyngeal mucus exposed to the carcinogens have also the 10 to 20 survival of oral cancer have developed another primary head and neck the cancer. Okay, then other risk factors which includes is basically tobacco quiet, which is pan masala, oropharyngeal cancer, which is plummer Wenzel syndrome, Epstein-Barr virus, alcohol, smoking, areca nut, basically reverse smoking, chronic irritation due to denture, poor oral hygiene, and poor nutrition. By this, tobacco, T for the tobaccoid, oropharyngeal carcinoma, O, Epstein-Barr virus, A for alcohol, C for cigarette smoking, chronic irritation, and poor oral hygiene. Now, we'll study some common sites in which the cancer develops. Is basically you have the tongue, then you have the cheeks, then you have the tongue, you have cheeks, then floor and gums. Now some important terms which is like hyperkeratosis is basically related to keratin production due to constant irritation. It is basically irreversible, and you have seen in the smokers the who smokes a lot, there is a hyperkeratosis. If you remove that causative agent, so the lesion will be normal. Then you have leukoplakia, which cannot be scraped off. It is a white patch in the mouth. Always remember that candidiasis can be scraped off, and the lesion that cannot be scraped off and it is white, so it is leukoplakia. And always do biopsy if the white patch persists for more than 2 weeks. Okay, now a very important thing which is actually leukoplakia. Leukoplakia is also a pre-malignant condition for the oral cavity. We are studying some important causes like smoking. Due to the smoking, there hyperkeratosis and basically nicotine which is present in your cigarettes that causes a pre-malignant changes in the oral cavity. You have spices and spirits also thus have effect. Then you have basically the sharp tooth you have, and basically sun rays and syphilis. You know that patient has also the have basically have a white patches. Okay, and have a glossitis tongue. Basically it is a pre-malignant condition, rare. Susceptibility of the person, then you have betel nut. Okay, then you have the stages, very important, the developmental stages in the development of the leukoplakia. Number one, you have the you have keratosis. Keratosis is basically keratin production, which is a milky blush on the surface. Acnotosis, basically elongation of the reti ridges and having a smooth, dry, white patch. Dyskeratosis is basically formation of the keratin in deepest aspects of epidermis before they reach the surface. Speckle leukoplakia has a multiple small white patches on the erythematous base and has a highest rate of malignancy of carcinoma. And then there's a carcinoma too. So you can learn by a cat, and then it is SC. Okay, then you have chronic hyperplastic candidiasis. For this you have to remember a mnemonic which is candida. You can remember C by commagers of the mouth commonly affected, A for albicans candida, and for there is no drug, surgery, laser treatment is basically the patient response. Then you have basically dense plaques of leukoplakia. Immunodeficiency can also be affected. Then it is very dangerous because has malignancy potential. And then you have antifungal treatment. Now moving towards some what is the treatment of leukoplakia in surgical point of view. You have studied in oral pathology, but now in oral basically we study the mostly it is um, histopath. Okay, treatment is like that 10% of leukoplakia transfers to oral cancer, and then you have to do a super excision. After the superior excision, you do what? You do basically by then skin grafting, very important. A drug, leukoplakia is irreversible, but there is a drug which is known as Isotretinoin. Isotretinoin basically reverses the leukopenia and reduces the risk of squamous cell carcinoma. Erythroplakia, which is a red velvety lesion and has the malignancy around 15% and 17 times more than leukoplakia. It is irregular in outline and have may be nodular. Then you have chronic hyperplastic candidiasis, which I have also told you before. You have to remember the mnemonic, which is candida. C for the commuters, A for the albicans candida, and for the no response to any drug, surgery, laser treatment. Basically the D is for the dangerous and or dense plaques of leukopenia. Then there's immunodeficiency you have, okay, and give antifungal treatment. Then some mucous fibrosis is basically either pan masala, areca nut with or without alcohol. Initially, it produces ulceration mucosa of the cheeks and the ulcers is resulting a dense squamous. So clinically, it is formed and hard. It can also affect the tongue, and basically, it is confined only to Asian population. It has the chances of malignancy to 10 to 15% as compared to when it comes to malignancy of erythroplakia, it is 10 to 15. Mouth opening may be restricted and it can be excited by reconstruction again. Okay. Then you have sideropanic dysphagia, which is Plummer-Wenzel or Patterson Kelly syndrome. It is basically what which we have studied. It is a oropharyngeal cancer. Iron deficiency occurs in the absence of anemia. Patient does not have anemia but has the iron deficiency. This patient always remember that the panic dysphagia common in this Scandinavian women. Iron supplements reduce the epithelium atrophy. So remember that common in Scandinavian women, iron supplements reduce the epithelium atrophy. If you are taking the iron supplements, it will reduce the epithelium atrophy. Papilloma of the tongue of cheek, discoid lupus erythematosus, disc keratosis congenita. Disc keratosis congenita is also basically a congenital disease. Patient mostly have this disease. Syphilitic glossitis, which is a tertiary syphilis that produces a chronic superficial glossitis. Okay, it can also lead to carcinoma and papilloma, which is also the virus. Basically in it has oncoprotein suppressor tumor that suppresses gene, and it can also lead to the tonsillar carcinoma and oropharyngeal carcinoma. Miscellaneous so dust, which is sinonasal adenocarcinoma. UV rays, you have lip cancer. In reverse cigarette smoking, you have palatal cancer. Very important point. Those patients who do reverse smoking will have a palatal cancer. Very important. Okay. Then